This was a fantastic event, very impressive. I was quite taken aback by the level of production, the organization.
It's been a very unique concept which we have been driving it for like 5 years now. It's very important to have this sort of a open discussion forum where you can connect the payers and the healthcare providers.
This small forum is making those little changes in bringing the varied stakeholders come face to face, sit around and talk in a very neutral atmosphere.
We set out to do something very ambitious. We had a theme which was patient-centric medical technology in the evolving health insurance landscape. The discussions were, like I mentioned, notch above what we have had in the past. So that was very nice.
The flow of the program, the stakeholders, the questions asked were as innovative as the discussions on the innovative technology was.
This roundtable is a gift because it allows you to be educated, it allows you to be inspired, it basically broadens your horizon and enriches your perspective.
This time is particularly crucial because India is launching the Ayushman Bharat program, which is covering roughly 40% of India's population through health insurance sector, and that's a completely publicly financed program.
Government at the national level has taken a big leap, trying to make healthcare affordable to a major section of the population who are more marginalized.
The reimbursing system in country is leapfrogging now with Ayushman Bharat, and under which is the National Health Protection Scheme, where rupees 5 lakh insurance cover is given to the vulnerable population, and I'm sure it would be a big milestone in the health insurance sector.
So that way it's a great scheme, but what is important is the scheme is not only about just saying how many people were treated, how many people were operated upon, surgeries done and all that. It is also whether they were given a good treatment, whether they were given a quality health care.
Insurance payers need to be educated about health technologies, specifically the newer technologies.
It's very high and dry relationship. We just look at the claims from very dry perspective. We don't talk to hospitals, doctors and pharma companies about what are the new technologies.
The newer technologies need to be brought into the packages. Packages need to ensure that there is enough provision for using the modern technologies.
Given the advancement of technology, given the penetration of technology, and there needs to be enough flexibility for physicians to be able to use the sort of products that they want to use for treating patients, for improving outcomes.
If we introduce quality by usage of new technology, the overall cost of healthcare would come down in the long run.
Innovation in healthcare allows us to do things more effectively, do things more cost effectively, and ultimately to add years to life and life to years for patients.
Through clinical trials that have a very isolated patient population, but the promise of real-world evidence is expanding this to be able to see if we can generalize our findings across broader patient populations.
If you look at the real-world setting, data can be collected in a lot more inexpensive ways than randomized control trial, which might not be possible always.
We need to adapt already existing guidelines of American Heart Association, European Cardiac Society and other bodies to Indian scenario. I don't think that we need to reinvent the wheel.
Given the changes that are happening in health insurance in the country, there is an increased need of dialogue with health insurers, with decision makers, with physicians.
Yeah, I think it is the objective of everyone, including the payers, governments or insurers, to ensure that people get good quality health care. But it requires collaboration of all the stakeholders. So I think that is where the roundtables like this do the job of bringing all the stakeholders together, making them understand what's really happening.
Innovation and implementing innovation into the system doesn't come on automatic pilot. It requires conscious decisions moving something from concept to care.